I'm Marie Yambo, coming to you from Afya House. Thank you for joining us. Now, Mashujaa Day, celebrated on the 20th of October, is not just a day to commemorate our national heroes. It's also a day to reflect on the progress and challenges in our healthcare system. Now, universal healthcare coverage is at the forefront of these discussions, as it ensures that every Kenyan can access affordable healthcare without incurring financial hardship. Now, to talk to us about the progress of universal healthcare coverage in Kenya is none other than the Principal Secretary in the State Department Medical Services, that is Harry Kimtai. Thank you for joining us.
Thank you and welcome to the Ministry of Health.
Asante sana. Also for creating time to talk to us about universal health coverage, which is actually one of the, can I say, the manifesto in the Kenya Kwanza government. So I want to start by asking, can you give us the progress of UHC in Kenya, and what are some of the milestones that we've been able to achieve since UHC was launched?
Thank you. First and foremost, I think it is good to say that this is not the first time the country or the ministry is launching UHC. We've launched UHC twice. However, it didn't succeed. When the Kenya Kwanza government came to power, they still brought it as one of their agenda under the better, that's the bottom-up economic transformation agenda. And this is because they had gone round across the country getting views from the public and to know exactly how are they going to deliver on universal health care or coverage agenda when they take over the government. They came up with a plan on how they are going to achieve universal health care coverage. And already they have started implementing the plan, and we as the Ministry of Health, we are the ones mandated to implement that plan. First and foremost is identification of the community health promoters. The community health promoters is not a new subject. They were previously referred to as community health volunteers. But under the Kenya Kwanza government, we realized the challenges that the community health volunteers were facing. And we realized that they are the ones who are going to promote universal health care, starting from the community level. That's why we said we recruit 100,000 across the country, depending with the population of the county. Each community health promoter is allocated 100 households. Now, starting from that, we realized that they were not being facilitated, they are not getting support. The national government engaged the county government, where they agreed that there shall be a stipend that is paid to the community health promoters. The national government will give the contribution as well as the county government. We've also realized that they will not be able to deliver on universal health coverage if they are not well kitted. And therefore, the national government has already procured universal health, the community health promoters kits. And these kits, they are going to be, they are given some basic tools or equipments that are used in identifying a medical problem. We're starting with just a thermometer to take to measure the temperature of a family, a child who is sick. We have a blood pressure machine just to know what is the challenges the family is facing in terms of blood pressure, because that's one of the key killer diseases that must be identified at a very early stage. Also, we are supporting them with a glucometer, one that will be able to take the sugar levels of a family. These are the chronic diseases that we are talking about. Now, on top of that, the most critical one is giving them the mobile gadget. Now, this mobile gadget is critical in the sense that we've removed them from the burden of carrying books and recording manual. We are now able to record this using a mobile gadget, and this information will be relayed direct to the Ministry of Health, where we have a system that will capture all the information and store this as a data. Okay. Counties will have access to this data at the different levels. Now, I think that's one of the biggest achievements, because that shows the rollout of the UHC. And why do we have these community health promoters? It is because of we want to shift from the curative to the preventive and promotive healthcare, so that we're able to minimize the burden of disease. We're able to minimize the cost of treatment. And therefore, that is one of the achievements. Okay. We've also introduced, because one of the biggest challenges we realized is when we were launching the previous UHC programs, we had not developed a legal framework. And therefore, we came up with a legislative agenda. And currently, we have 4 bills that are being debated in both houses, the National Assembly and the Senate. So that's one of the biggest achievements, and it's going to be the foundation of universal healthcare coverage in the country. The rollout of these CHPs will be on the 20th in Kericho, where we want to showcase, we want to show the country that indeed the community health promoters who come from the community have been kitted, and now they will receive service at that level.
Okay. So, you know, you've brought a very important component of healthcare, which is human resources for health, and the community health promoters do definitely, you know, form that part of the human resources for health. You will actually kind of, you know, explain to Kenyans, because there is sometimes a confusion. Are they trained to treat or to refer? So you'll be able to explain to us that, and even some of the, can I say, the progress that has been made to ensure that we have specialized, you know, medical personnel, and how is your department working, especially when it comes to issues of commodities. You know, issues of medicine in our hospitals have been quite a challenge. Yes. So maybe you could address that as a very critical component to the universal healthcare coverage.
As I told you, in terms of realizing that we must achieve universal health coverage, we had to look at the legal framework. We had to amend various legislations also that were existing. The Health Act, for example, we had to amend to make sure that it's aligned. The Mental Act amendment of 2022 has also been aligned to cover a universal health coverage. Now, talking about these community health promoters, what are they going to do? Are they trained human personnel to support in, not to support, but to treat?
Yes.
I want to say no. They have been trained in basics and to support households when it comes to discussing the wellness of a family. They are the ones who are supposed to just do the tests, for example, for hypertension, because they have been told on how to conduct that test. When they realize that the family say they are hypertensive or their blood pressure is high, they simply refer them to the next facility, a level 1 facility, level 2 facility, where they will meet now a trained medical practitioner. That's now the trained human resource that provides health. Within that, as they register them, within that community, we have what's called the primary care networks, meaning every time they capture the data of a household, the data will be shared within the community, the primary care networks. And primary care networks is simply the level 4 hospital and level 3 and level 2. So every time the trained personnel will be notified using the data, the information that has been captured, that there is a patient who is hypertensive or who has high blood pressure or the sugar levels are high, that then will seek medication at the facility. Now that is where the difference is. They have simply come to support the health human resource, trained human resource at the community level
and not
to
to
refer
treat.
them and not to treat.
Okay.
And in the primary care, the primary healthcare bill stipulates what they are supposed to do,
Okay.
because we do not want them to go beyond what they have been trained to do.
Okay. Could you speak to us, in terms of the commodities, how you're working with the KEMSA?
Yes, in terms of commodities now, they have also been trained in a way that they are able to know what kind of commodities are available in which hospital. So what we have done at the same time as we were training the community health promoters, we did what's called, we undertook a survey, levels of assessment of service in each and every facility across the country. So we now know in each of those facilities what services are being offered. So the community health promoters will also have information that within the primary care networks, meaning the facilities, the hospitals, dispensaries, health centers, and sub-county hospital, what are the services that are being offered there? So when they are informing the person who within the community has been identified to have a problem, they will simply tell them to go to which level of hospital, because they will get that service. If it requires a doctor, for example, then they will know that at level 4, there are specialists or there are doctors who can attend to this patient. Okay. So what we are doing is basically providing the community health promoter with information so that they are able to inform the public or the households that they are dealing with on where to get services. Now, talking about commodities, KEMSA, we're also going to integrate using digitization. We are going to integrate all the hospitals with using a digital system that will be able to show KEMSA that there's so much, this kind of drugs that are being prescribed are getting depleted, and therefore it requires for to be supplied. So KEMSA is able to track all the facilities and be able to make sure that drugs, medicine are availed without delay. Now this is going to be seamless. The key thing here is information. How do we capture this information? That's why we have got the digital health bill that will bring what's called the digital superhighway to link all these facilities to service providers like KEMSA, like our current NHIF, where they will now be able to know that these are the claims that we are bound to receive once the patient has been treated. So this is a total integration of our systems using a digital system. But the most important team that is on the ground are the community health promoters. Okay,
very well said. Now, UHC, with Human Resources for Health and even, commodities cannot be done without financing. Can you give us some insights as to how the UHC is being financed?
Well, again, it is in the reforms legislative agenda. If you look at the social health insurance bill that we have tabled, and it's now the final stage of both houses have said, is that we have created 3 funds. The first fund is Primary Health Care Fund. What is this Primary Care Health Fund? And Kenyans have been talking about it. They say we are creating 3 funds, like we have now 3 NHIFs. We are saying no. We only have 1 social health authority that will manage the 3 funds. The Primary Health Care Fund will enable a patient who goes to the primary level facilities to be treated, and they will be discharged. They will go home with medication, and that facility will be able to claim from the primary health care fund. Now, the social health insurance comes in at a certain stage. At that particular level, we are saying each and every household must be registered with the social health insurance. Now, that is our normal NHIF. This one is at the primary level, where it's a walk-in, walk-out, you are treated, and there's services that you are supposed to provide, and that service has already been costed. And when they make a claim to the primary fund, they will be that facility will be refunded. Then we go, since you have all registered now under social health insurance, you will be able to still get services as provided under that package. Then we have the emergency, critical, and chronic disease fund. This is where, if, for example, you've been diagnosed with having a critical illness and your social health insurance cannot cover, this is when this fund will set, and now you'll be able to the facility will be paid from that fund, from the critical or chronic disease fund.
Okay.
What we are saying here is we are minimizing out-of-pocket expense that we have seen Kenyans paying for health treatment, where they sometimes have to incur money from their pockets or through Arambes, or families getting their resources depleted because of a disease. That means we understand the disease burden in Kenya, depending with the different levels. So we have done that to cater for it.
Okay.
Now, but the most other critical thing on this, where funding now comes in, we've also realized that as people access treatment at the county facilities, we have agreed with the counties and the Facility Improvement Fund, that's another bill that is also in Parliament, that the funds that are received or revenue from the hospitals shall remain at the facility.
Okay.
At the facility now, they will be able to meet some of the critical expenses that doesn't require funding from, it requires funding from the county allocation, but now that will be an additional to them, where they will now be able to quickly, if they run out of drugs, for example, they're able to procure drugs within a short time.
So they don't have to.
So they don't have to depend on allocation budget from the from the county assembly.
Okay.
So they will be given permission now to spend at that particular level. So you can see in terms of funding, we are well covered because all that revenue now will be secured within that facility.
Okay. And you brought a very critical component, because, health is devolved, so the counties play a key role. And this year, we are actually celebrating Mashujaa Day in Kericho County. So maybe you could take a chance to, make a call to Kenyans. What would you want to tell them as far as the Mashujaa Day is concerned?
First and foremost, the ministry is totally aware that health is devolved, and what we have done is all the devolved function of under health with the resources have been devolved, with attendant resources have been devolved. So between us and the county, we have no challenge in implementation, and counties are aware of their responsibility and that function that they are supposed to undertake, as provided for in the Constitution. Now, there are a lot of achievements that I can say the counties have made a lot of strides with the support of the national government. For example, when they were supported to acquire some of the medical equipments that have been deployed in some of the referral counties, like the dialysis machines, not just having one or two, but the number is now increased, the number of hospitals getting those machines. A lot of people have been able to access service. And what we are saying is that if there's a collaboration, we continue having collaboration between the national government and the county government, then the counties will be able to achieve a universal health coverage.
Okay.
At the national level, we will not do it at the Ministry of Health to achieve universal health coverage. But at the county level, that's where we shall achieve it.
And that is why you're holding the Mashujaa Day, just to emphasize
and just to emphasize, now we're saying at the national level, the president directed that as we celebrate any of our national days, there must be something that we're celebrating about. There must be something that we're talking about. We are privileged that this year, Mashujaa Day, it is the Ministry of Health and the counties who are performing the functions of the default functions are now coming together to celebrate Mashujaa Day. We've teamed up with the counties and we are telling them that let's all join hands to celebrate this year's Mashujaa Day under the theme of universal health coverage, which will be done in Kericho. But this will be celebrated across all the counties. The theme will be common across all the counties.
Okay.
Key thing that we've told them to do, and if possible, is actually to roll out, to launch the community health promoters within the counties so that the people are aware who are these community health promoters that has been launched nationally and within across the counties.
Asante sana, Principal Secretary, State Department for Medical Services, that is Harry Kimtai. He's been speaking to us about the challenges, but mainly the progress that has been made since the launch of universal health coverage, here in the country. And he emphasized that this time round, they are going to succeed. So thank you once again also back at home for taking your time to listen to us. Remember, Mashujaa Day is on the 20th and it's being celebrated in Kericho County, mainly focusing on the strides made in the healthcare system. So thank you again. Once again, my name is Yambo. Hope to see you again next time.